really one cause because technically it's kind of sort of combined because nutritionally.
This is like a vicious cycle. There are conditions, medical conditions, that exacerbate or are linked to
committing suicide, then you really need help. Those might be red flags.
alcohol, addicted to cigarette, sex addicts and all. The moment you start giving medication to stop the addiction, they lose interest in life.
What is it that you're not telling me? Does that get you to different points of you wanting to answering me as compared to how are you?
A way forward on do I really need to seek help or not?
So your high school friends send you a message. We're having a reunion. Come join us. And you say, no, I'm not up to it. Now that response could point to something a bit deeper. Welcome to the Med Squad podcast. My name is Yafesi Musoke, and we'll be looking at red flags that could point to depression. I have the Med Squad with me, and I'd like them to introduce themselves, starting on my left.
My name is Dennis Mandere. I'm the therapist at Zuri Health.
Welcome.
Thank you.
Hi, my name is Cynthia. I'm a nutritionist. One line I want to leave you with: you are what you eat.
Okay.
I'm Anthony Ndegwa, a general medical practitioner at Zuri. Welcome.
All right. Now, as we start, the obvious question would be, has any of you ever been depressed? And if so, how did you know that it was depression?
Technically, I haven't. So maybe just having the usual low moods and things like that. But I wouldn't say I was depressed. Yeah.
Okay, it's a good question, but sometimes probably I don't know if I was depressed or so. Sometimes you have those changes in behavior, probably how you feel generally. You're sad.
Yeah.
It depends on what criteria you use to define depression. So, in simple, I won't say that I've been depressed before.
And for you?
I feel like I've felt sadness before, but I've never reached a point where I was depressed.
Wow. Okay. So, I mean, for me, I can definitely say yes. I have been through it, experienced it. But the question would be then, because you mentioned sadness, you mentioned some emotions. Then, what exactly is depression? How would we define it clinically or professionally?
So when it comes to both of them, there's depression and there's sadness. We often have misconceptions between the two. You might be feeling sad and you might label it as being depressed, which is not the case. Sadness generally, it's a temporal natural feeling with regards to natural life events. For instance, if you lose a parent or a child, if your wife has a miscarriage, you might feel sad. Okay. Now, when it comes to depression, this becomes a bit more complex. It's a persistent feeling of that sadness over a particular period of time. There will be remarked loss of interest in activities that previously were fun to you. There will be some mood deterioration on your part and such and such. Yeah.
Okay.
So one is temporal, the other one is persistent.
Okay. So the persistence. Are there any statistics around depression? Because also, when you think in the cultural context or economic context we're in, prolonged sadness has been prolonged. So some people may not even say they've been depressed, but the prolonged sadness, is it pointing towards people heading towards depression? Or is it also, what's the length of, what do you mean by prolonged? How long are we looking at?
If it goes for a period of more than 6 weeks, then you might be clinically diagnosed as having depression. When you're talking about the cultural aspect of it all, going back 100 years, when the first practitioners of mental health came to Africa, they didn't find us with having any depression, which is kind of weird, right?
Yeah.
Like the African community was so close-knit to a point where nobody was presenting with depression, and they kind of quantified it to us having smaller skulls, conversely having smaller brains, having no capacity to develop depression. You get me? But as urbanization came on the African continent, then you found the individual was more segregated away from his community, then depression started kicking in.
So it didn't have anything to do with the skull.
The skull group.
It didn't have anything to do with the skull.
The skull grew when they.
It was a misconception that we had smaller skulls back then.
Yeah, they play
Just,
rugby
just to add on
against
the same,
Mm.
in terms of the history of depression, depression can be traced back to the ancient Egypt, as old as humankind.
Yeah.
So even the word depression itself comes from the word deprimia, that means being weighed down, that feeling that you don't have the energy, the mood, you don't want to do anything, and that's kind of. And you also see it even with major, like renowned people like Churchill, Winston, who would describe it as black dogs. During the Second World War, he could feel that feeling of sadness after the exposure to the World War and all those things. And that is where we see the surgence of depression. And probably it was stereotyped as something that was not as a pathogenic or something that could inhibit somebody's lifestyle. But in the recent past, we've seen people are really talking about it and its effect on our livelihoods. So depression is as old as you are old, as a humankind.
But yeah, we have been where the story of King Saul and how he used to call David to play for him music, and then still he throws a spear at him. So what are the causes of depression?
I wouldn't say there's really one cause, because technically it's kind of sort of combined, because nutritionally you have to ensure you're getting all your nutrients. I'd mentioned serotonin. So serotonin is almost like the feel-good hormone, and we get that once we consume its amino acids like tryptophan. So it needs that precursor and complex carbohydrate to give you that feel-good hormone, because the complex carbohydrate helps the tryptophan to go to the brain-blood barrier. And then now it's converted to serotonin. That's how you get your good mood.
Yeah.
So we can't say like it's really one exact cause. It's just multiple things falling over onto each other.
So the good mood is not showing up for a
Exactly.
prolonged period.
Yeah.
You mentioned amino acids. Me, and you say amino acids, I think they protein. I think of
It is protein. So like tryptophan is an amino acid chain.
hamburgers.
No,
Mm.
lean meat, please.
Okay. Okay, lean meat.
So yeah, lean meat from chicken, turkey, and also eggs.
Chicken, turkey, and
Yeah.
eggs. So you're saying red meat is not going to help me?
Well, a bit of red meat is okay because we do get some of the B vitamins from there, and also B vitamins are essential in helping serotonin get into the system. So they kind of go together generally.
So it's easier to remember. B vitamins, be happy.
Exactly.
Oh, okay, fine. So
Okay, Yafesi, you also talked about the statistics
yes.
and the prevalence and incidence of depression worldwide in Africa. So according to the WHO, we are estimating over 300 million people could be having depression, clinical depression. However, yes,
Wow.
worldwide. So back in Kenya, we have studies that struck back up to around 2017 that showed the prevalence of depression in Kenya to be around 2 million people. We're looking at ages of 18 to 30, young people. But you see, when you look in the modern society, people are more depressed. So the ease with which we get people with depression has really gone down because people are not going to get health care. The health-seeking behavior, especially in men, is low. So you find we are more depressed than we think. It's only that we do not seek help. Yeah.
Is there a higher prevalence among men or women, or is it more manifest in one gender or the other?
So anybody can get depression, both males, females, even children, even young adults, everybody can get depression. However, statistics show that we have more women with depression. That does not mean they are the ones suffering from depression alone. There is an issue of hormonal imbalance, mostly prevalent in women, and also men have less health-seeking behavior. So it means we don't get them, not because they are depressed. It's only that they don't come for help.
They're just
So studies have shown that more women have depression than men. But generally, we are talking about 1 in 4 people being depressed.
So this habit of telling people strong, or someone tries to actually open up, and say, I'm going through something. They may not say I am depressed, but they've noticed a change in their own behavior. So how, if I'm not a professional, are there things I can look out for among my peers, my friends, or my family that maybe I would be like, either refer you to a professional or at least lend a helpful ear to understand so that we can prevent some things?
You're asking from an individualistic perspective or from someone observing someone else?
Both. Yes.
All right. It's a broad range of things that you can look up to. You can check for things such as, have you been losing interest in things that you previously liked doing? How is your appetite? How is your weight? How is your interactions with other people? How is the quality of the relationships you have with people around you, your family, your friend, your work? How is your productivity as an adult? How is your sex drive? How much do you sleep during the day? How much do you sleep during the night? How is the quality of sleep? In complex cases, you can go have a test done on your serotonin, because serotonin is really critical, especially for people who have committed suicide. When their autopsies are done, you find the level of serotonin is really down in the pits. Yep. So when you have low serotonin levels, then you have issue with depression. So that's where you get medications such as serotonin reuptake inhibitors, which kinda block your paths in terms of reabsorbing the serotonin in your brain, which helps in curing your depression, so to speak. Yeah.
So then now, mentioning such things that can actually be tangibly tested within your body, is it possible to inherit the depression? Can it be, is it hereditary?
Sure. It can be hereditary. We have cases where a mom was depressed and the kids who came after her developed the same symptoms, which is kind of unfortunate.
Wow.
Yeah. So probably like when most people are dating, you kind of urge people to really go into the background, especially the medical background of the person you're dating.
Yeah.
Find these things that mostly you won't find the family having conversation about them openly.
Wow.
Yeah.
So as a date, you do, okay, the HIV test, now you do serotonin test also, and will your partner look at you like you're a weird person? Or
It
Or is
depends
it
on
hardly critical?
It depends on how you broach the subject. Communication is key, right?
Yes.
If say I'm dating, say, Charity.
Over a plate of chicken, don't you? It's cheap.
Say if I'm dating Charity and I was to go the subject over to her, will she be concerned about what will pass down to our kids? Yeah. And if it's a person you're dating and they're not open to having such a conversation, are they a person you really want to have in your life, so to speak?
Okay. So the openness element is
And the ability to communicate.
yeah.
Yeah.
Now, we'll be talking about communication in a bit more detail. And by detail, I mean we're getting into the actual red flags. You're on the Med Squad podcast. We'll be right back. Welcome back to the Med Squad podcast. We're talking about a subject that in some areas is taboo, not because it is culturally expected to be, but simply because people are not talking about it. But in other areas, they actually don't know what to look out for. And so with the Med Squad right next to me, we have Dennis, we have Cynthia, we have Dr. Anthony. We are going to actually try and decipher these red flags. So what I'm going to do in the African context, I'm going to make some statements and then we'll discuss how they may or may not signal something deeper. So, flag number one, I just feel tired all the time. I'm always tired. Is that something, or am I just unfit?
It is something. That's pointing to you feeling fatigued most of the time. Then we ask during the duration of a day, how fatigued do you feel you are? Has this been presenting during the duration of the whole week? Yeah. How long has it been going on?
Yeah.
Yeah.
Okay. So, hey, these are things to look out for. I am not hungry, or I am always hungry.
That's something you really have to look out for, because generally, as at now, you already know how you usually consume your meals, right? You know, if you're consistently taking breakfast, snack, lunch, snack, dinner, maybe just the 3 meals, then over time you start increasing. You have to look back, as he said, check the frequency. How has it been changing? Has it been maybe a day? There are some days you wake up, you're extremely hungry.
Yeah.
But then if it's now becoming a recurrent thing, you have to wonder, are you using that as, are you speaking to people on that in terms of your diet? Because it could be a trigger and a reaction.
Would deworming be an indication of what?
Technically, we have to deworm every 6 months. So,
Oh, it's every 6 months.
have you dewormed your face?
So the other question, in terms of eating.
Why didn't you answer that question?
No, so in terms of eating, what about the cravings? Now, you know, you have your normal meals, but just excessively, or you don't. But then also there are times when you eat,
You do crave other things.
craving sugar and salt, or things that may not necessarily be.
That could also be an indicator of something. If I'll use women as an example, or rather, I'd use me. When I'm closer to my cycle, I tend to crave sugary things. But now it's up to me to decide, do I really want to take that Coca-Cola, or probably just take a fruit instead? It's the healthier option. So if you find yourself over craving a lot of sugar, could be a sign, or could be even a more underlying issue rather than depression.
Okay.
Yeah.
Yes, deworming. The last time I did it,
19.
oh my goodness, something caught in my throat. I
Oh,
was like,
sorry
to
for
answer question. So the next flag is what I had mentioned earlier at the beginning was this withdrawal. I'm not up to it. Withdrawing from events, social hangouts, even weddings or WhatsApp groups. Even if your favorite team finally wins something, people are not seeing the same noise you used to make. Is that?
Yes. So one of the symptoms or a red flag of depression is something called anhedonia.
Anhedonia.
Yeah, the loss of interest on things you previously liked doing.
Yeah.
Okay, you have to understand that as humans, we work with a reward system. The dopamine, serotonin the mechanism. Okay, so the moment you start losing interest, remember, when you lose interest, for example, let me give you an example. If today you start giving people, if there was an experiment done where some rats, they were given some pellets and they wanted to take them, and then they were kind of addicted. And then you gave them some chemicals to stop the addiction. It happens with people who are addicted to alcohol, addicted to cigarette, sex addicts and all. The moment you start giving medication to stop the addiction, they lose interest in life. And the moment you start losing interest in life, then you're kind of depressed already. Okay? So it goes down to your psychology, where we call the nucleus accumbens, the hippocampal. In fact, even when you do imaging of these people, you'll see actual shrinkage of those centers, the reward centers and the contentment. Remember, dopamine is more of pleasure, and then serotonin is more of contentment. So when both of these, there is a mismatch between them. It's more of hormonal imbalance against psychodynamic imbalance, psychosocial issues, and then that's where you find people, they lose interest in their life. And it's very holistic. It's not just, I don't want to do this, but generally, so many things in my life that I used to enjoy, I don't want them no more.
Okay. That's kind of tied into the next one, which is more like, hey, as the Nigerians would say, if it change them on you, change them for you. You know, personality, like you're just different.
Yes.
Now, could it be confused for like your station in life? You're different when you're in your teens, of course, 20, 30, 40, 50. So it could be just either maturing or a change in personality. How do you know then the personality change is something to look out for, to be a flag?
Okay. So when we're saying that there is mood change. So you're looking at temperaments. Okay, that just because I've been offended, the level of temperament I will show is something that will be inconsistent. But now today, just because of small things, I am bringing issues, I explode. Okay, so there is a change in temperament for that person. The other one is mood. As we said, serotonin and the dopamine, they are hormonal. Mood is hormonal as much as you might think it's social. it's very hormonal. So the mood change, the issues that person is dull. As we say, depression is just feeling weighed down,
Yeah.
pressed down. You just feel as a person, you don't have the energy to do things, and also the feeling that you have. Even the self-esteem can go down. You understand? So it's a very generalized feeling that the person does not really enjoy the life he used to enjoy. So temperaments are and temperaments are going to define your personality.
Yes.
Yes.
So now someone else may be, the world has changed. And how we were before, if we didn't have the internet, I would have been fine.
Very.
But now that I'm seeing kind of, Europeans, Asians, South Americans, of course the Americas, there's kind of a more or less centralized personality that's going around. And if you don't match up to that, it could actually have the reverse effect of causing me to feel inadequate. And so when we look at social media and the world becoming smaller, even kids nowadays, 5-year-olds have accents from Chicago because of watching American cartoons and things like that. Does that also contribute? Because you might say personality, yes, but if I don't know who I am, I don't have an identity that I can solidly say this is mine. How does that affect this particular area of personality change and the dopamine serotonin merge? Yes.
The question will be, were you given a good enough environment for you to develop a personality strong enough that if external forces were to be exerted to your mind, that you will change? Yeah. 20 years back, people never used to wear skinny jeans. You remember?
We are so grateful for that time.
Yeah.
Yeah.
So how come we have developed a thought process where it's okay to wear skinny jeans? You can influence the brain in a positive way and you can influence the brain in a negative way. So you have to develop your kid in such a way that they are open to experiences that develop them in terms of a positive personality, where they know this is bringing positives to me, whereas they have the defense mechanism and the coping mechanisms where they know whatever is being influenced upon me on these social media platforms, it's not okay for me. I don't need to do a certain gig, which is probably illegal, to acquire a certain amount of money to live a certain kind of life. I need to grind it out the normal way. Okay.
So I'm actually interested in the generational conflict. You said now depression can be inherited, yes, but now when you're seeing how there's certain mindsets that were, hard work and all the reward comes, there were reward systems that had a certain pathway, but now people are more like, I just want to be rich and famous. I don't care how. And when we start saying, no, this is the proper way to do things, or this is the right way, that containment, or that telling me what to do, isn't that also now presenting another generation with a form of, a source of depression, or the roots of depression?
It does, because everybody is driven by their own set of demons, per se. What are you running away from? Is it a family with a not so good financial background? Are you running away from the family itself, from how you're brought up? Are you trying to run away from the country as it is? You get me? So, as much as you're trying to do something, what's the thought process behind it? What's the drive that keeps you waking up in the morning to try and do the particular thing that you want to do? Okay?
Yeah.
So, add that up to how you're brought up and how your coping mechanisms and your thought processes. Does it lead to you taking a right decision, or does it lead you to taking a wrong decision? If you're taking the wrong decisions, you might end up trying to hide some of those demons.
So Yafesi, we're saying that people will want to take out their stress or probably depression on food. The challenge is, this is like a vicious cycle. There are conditions, medical conditions, that exacerbate or are linked to depression. For example, diabetes. We know that all clients with diabetes should be screened for diabetes. Conditions with stigma, HIV, STIs, we're talking this condition, even issues of disability. People are really suffer from depression. So when you try and eat out, you're likely to develop other metabolic problems. For example, if you eat out, unhealthy diet is associated with development of non-communicable diseases, hypertension, diabetes, and all those. Now you're compounding on your risk factor for the same. So it is really a very bad road to go. Nutrition, and then there is the opposite. There are the guys who don't eat now. They go the route of malnutrition. They don't have, as we said, depression can be associated with suicidal ideation. You might not physically kill yourself, but you can starve yourself and you develop other problems. So it is something to watch out for both. And issues of eating disorders have been spread mostly by social media, where people don't like the way they are, personal acceptance and self-esteem. They want to look like someone. And generally, that one can be compounded with depression, and you end up now developing depression, eating disorders, and now physical conditions that you really need medication for. Yes.
Now, finally, in terms of flags, this one is someone who says, I'm in pain.
Yes.
And yeah, so
Okay.
I just leave it at that. Yeah.
So just know that your brain sometimes does not recognize physical pain from mental pain. So when somebody tells you they're in pain, the emotional pain, the grief that somebody might be going through, the brain does not interpret it differently. So if people, in fact, there is a saying that there are people who suffer more in their brain than they actually suffer in the society. So if I'm feeling pressed down, low on mood, energy, emotionally depressed because of somebody probably they are doing, it can really be hard on me. So when somebody tells you that they are in pain, it is not something to brush off. It's something that you should take in keen of.
Is it possible to get, physical pain manifesting that's even traceable from a mental condition?
Yes, it's possible. You know, pain is subjective. If you tell me that you're feeling pain, I cannot deny by the fact that I am a doctor, I cannot say you're not feeling pain. So we treat it the way it is. If you're telling me you have physical pain, I'll give you a remedy for that. But some people will have a psychological pain, and it's still pain, so you have to manage it. In fact, there are different types of pain. There is emotional pain and there is physical pain.
Okay. Well, we'll be right back on the Med Squad podcast, where we'll actually be giving you practical helplines, things that you can actually do. Stick around. Welcome back to the Med Squad podcast, where we have candid conversations about health and wellness across Africa. And as the conversations get candid and there's something you feel you need to share, put it in the comments or just join us on our social media pages. Let us know what you want spoken about, or let us know if you need help specifically with something. And speaking of help, we've been talking about the red flags to do with depression. Now, the biggest or the ultimate red flag, of course, is suicide ideation. You mentioned suicide ideation. Now, at such a point, what do we do? How do we get to prevention? Because a lot of people, if it actually goes through all the way, the people left behind are like, what more could I have done? Or what could I have done? I didn't know. I didn't notice. So when we're addressing suicide ideation, are we talking to someone who might have the idea forming in their minds, or are we talking to the people who now later realize that this was what was happening?
To be honest, from an observant point of view, there's nothing much you can do. Especially when it comes to, say, suicidal ideation in men, because they usually take the most violent routes. It might be a gun to the head, it might be jumping in front of a moving truck, it might be hanging. And the fatality in such cases is almost guaranteed 100%, as compared maybe to females where the mode of suicide might be taking an overdose of pills or maybe slitting their wrists. There you have a small window of rushing them to the hospital and maybe having them receiving care. In such a case, as you asked, I think the best route would be talking to the individual who is having this kind of thoughts in their minds, that the situation that they're going through can be reversed. It's never, there's always light at the end of the tunnel. Yeah. That the stresses that have been put upon them for a prolonged period of time, they're normal. It's a normal process in life that you need to go through, but there is always a way and coping mechanisms to be developed to get away from such a position.
Okay.
Yeah.
Is there a way the prolonged state of being like that, by the time you get to this point, is there a chemical imbalance that can cause you to not be able to see a way out?
As we said, depression is also hormonal. There is a sense of hormonal imbalance. That's why even the medication we use, they are trying to balance you on your hormones. So
And the neurotransmitters.
yes.
Yeah.
So the issues of how chronic it is before you get really hormonally imbalanced, even on acute, you're still having hormonal issues. So the chronicity just makes things worse if you don't seek help faster. But the background or the mechanism is still the same. However, I'd want to ask our therapist one question. That studies have shown that majority, over 80% of people who commit suicide, they have had a contact with a mental health practitioner. Okay?
80%.
Yes, that you've gone and seen a therapist, or somebody has diagnosed you with something, and then you kill yourself later. So, him personally, have you had somebody kill themselves after seeing you?
Not really. It's a funny case because even practitioners really try to run away from suicidal cases, trust me, because it actually really messes you up even as a practitioner.
Yeah.
Because the thing about therapy, it's you have the empathy to put yourself in that person's shoes.
Yeah.
So you work with them in how long have you had these thoughts running in your mind? Have you worked through how you go about with it?
Yeah.
These are normal questions you ask, especially in a suicidal case.
Yeah.
So that you judge how much this person has really thought about it. And if they're under medication to balance their neurotransmitters, well and good. But in most cases, in suicidal cases, you really can't have a foothold of saying, I, as a therapist, really can't help you
Yeah.
in trying to steer you away from these kind of ideations. Yeah. You really need just to be there with them in that particular moment. As compared to other psychosocial conditions, suicide is really, really tough.
So, still on the same, we know that suicide is among the leading causes of death in the world. So, in terms of depression, how much are we looking at in terms of the mental health aspect? Because I am thinking for anybody to kill themselves, it's more of mental health. So, other than depression, do we have like other conditions that are associated with that? Because mainly for us, we see medical cases and we always channel them to therapists. So what is your observation in terms of other conditions like having a role in suicide? Because suicide is a big thing.
So suicide is a big thing. Depression also is a big thing. But in the context of mental health, they are elements to other things. It might be you having a patient who has schizophrenia, or maybe a patient who is having depression, bipolar disorder, which is a mood affective disorder. So if they're having bipolar disorder, they might present with mania, hypomania, and a depressive episode. So when you're dealing with them at a depressive episode, which really hits them hard, because it's an oscillation of their mood from way energetic to really, really catatonic. So you might find them at a suicidal point. So suicide might be a subcontext of depression, and depression might be a subcontext of a larger psychosocial disorder that the person is presenting with. And apart from that, it might even stem from other factors. It might be cultural, it might be religious, it might be social economic factors. That's it. So it's a broad topic to navigate around.
So now,
Yeah.
just to narrow it down to an individual, where can they seek help? Because now we've talked about, okay, someone might be watching and notices some red flags. Then they're like, okay, what do I do next?
Well, the moment you have at least two thoughts of committing suicide, then you really need help. Those might be your red flags. Once in a while, life might put you at a position where you feel like, "Ah, I want to jump in front of a truck." Normal. But when it repeats itself, then you need to speak to someone. You need to see a therapist. Then there might be a pharmacological intervention done to you. If maybe the serotonin levels are low, then you need to speak to a nutritionist on how to bring them to a level where it's acceptable for you to operate normally.
All right.
Also, they can also use toll-free numbers to speak to therapists or get any further help. Yeah.
Yeah, and on the same,
Certain things,
yeah.
speak to someone.
Yeah.
Speak to someone.
And today we have even to modernize and for people to realize they need help, we have online criteria for where you have to fill a form. They're automated, where you fill a form of some symptoms you go, because the diagnosis of depression is mainly clinical rather than laboratory based. So you have to fill a form. How are you having the eating disorders, issues of social isolation, temperament, and all those things. And you can get a way forward on, do I really need to seek help or not? So it's something that we should uptake. It's online. These forms, you just fill them, and based on your and on the reviews you get, then you seek help. And there are so many ways. In fact, especially for men, with the online and social media, you can speak to people anonymously. And again, with the virtual consultation, you speak to therapists. So there's no reason to stay at home with a problem. You
Yeah.
have to share. Earlier we said you could share to people, but because of the society is more capitalistic, where people don't want to listen to you, you keep, even we were talking about the greetings we have. For me, they are more of a routine. People don't really care of how you feel. But when you seek help, you're the one in problem. So you need to seek help. Okay? You don't expect me to ask how are you and follow up and know if you're depressed or not. It's you to realize that whatever I'm going through is not normal and there is help for me. You have to take that proactive measure for the sake of your health.
Well,
Even the communication bit, as you mentioned, if we have a robotic way of answering things, if I was to say good morning, you would say,
good morning.
how are you?
I'm fine, thank you. And then I say, how are you?
Yeah. And then I repeat it back to you. What if I said something like, what is it that you're not telling me? Does that get you to a different point of you wanting to answering me as compared to how are you?
It definitely changes my
Yeah.
outlook. Like, okay, yeah. All right. So that's actually, so instead of just saying, how are you? Fine.
Because the answer will be more robotic. Just find a way of communicating to make it more intimate between you and the person you're asking.
Yeah, and on the same, I think the rise of social media has really amplified the aspect of depression because of social isolation. People tend to be indoors, just on your TikTok and all those things. And we don't have a diagnosis for phone addiction, but social media addiction is a really big thing. In fact, when you look at the modern studies, people are looking at what are the criteria for us to know that you're phone addicted. That if you take that phone away, people get anxious, people are temperate, they cannot connect with people. And that is one aspect, social connection. If you're having issues interacting with people, it can really go down to your personality and your social interaction, of which it can point towards depression. So as in general, I'd say the society is kind of more depressed compared to the earlier generation, just because of the social media.
Yeah.
Yeah.
Hey, well, that brings us to the end of the Med Squad podcast for this episode. The helplines are in the link. You can actually reach out for help. Whatever you're going through, you're not the only one, and you don't have to go through it alone. There is help. You can follow us on all our socials at the Med Squad Pod. Let us know if there's anything that you want talked about or want addressed in any episode. And if you found anything useful here, please share it. Please share it. This help could be for someone else, if not you. My name is Yafesi Musoke. We'll see you next time on the Med Squad podcast.